guys keep up with my social media, I did have surgery to these bad girls over here. And I got so many questions and DMs and messages afterwards. What a lot of people don't know actually is that I worked for him first. So I actually worked at Aydin Plastic Surgery first, and that's kind of how I met him. And there's like no better way to get to know someone's work than to literally work for them. And I would see for myself like the breast augmentation patients like coming in afterwards, and I would literally see the results myself firsthand. That's how I met him, but seeing his work firsthand made me trust him so much, and I trust him with everything. So that helped making my decision a lot easier. I was asked what the recovery process was. So the recovery process is not that difficult. It's just you have to stay in bed. Like, I stayed in bed for at least a good 3 days, like not doing anything. Like I would get up and walk to the living room and come back because I was in so much pain. What I can compare the pain to would definitely be like someone sitting on your chest. That's what you feel. It's not even pain, it's like discomfort. You feel discomfort. The first night after surgery, someone had to sleep with me. Like, I could not sleep by myself because I had to get up like in the middle of the night to pee. I could not get off my bed by myself. I needed help. I needed help pulling my pants down, my pants up. I needed help opening up my medication. I had to take medication like at all hours of the night. But they definitely prescribe you medication that helps you get through the discomfort. But I kind of want to talk about like the beginning, like the actual surgery date. Like, you guys need to know what the experience is like, especially if you've never had surgery like me. That was my first surgery ever, and that was the craziest experience because I was so freaking nervous. So I walk into, by the way, I did not do it at a hospital, I did it at a surgery center. I did it at Oradell Surgical Center. So I'm with my mom, my dad, and my little sister, right? And I'm walking in, and immediately it's just like this cold feeling. Like, it's a surgical center. It's not meant to be like warm and loving and like cute and like, and I was just like, oh man. So I was sitting next to my mom, and the first thing that happened was the nurse ended up calling me and ended up having me sign, obviously, consents. And the first thing she asked me was, do you have a will? I was like, what? Do I have a will? Like, am I supposed to have a will? Is anyone supposed to have a will before a breast augmentation? And she said, no. It's just policy. We just want to know. Because it's no secret that any surgery, you know, you have the risk of having a complication and dying, and that's just any surgery. So that's policy. They had to ask me that. No, I do not have a will. And the nurse is like, yeah, the nurse will be out shortly. And I'm like, take all the time you freaking need. So the nurse did come out very shortly after. It was a male. He was so nice. I don't even remember his name. I feel so bad. I think he was Kevin. I don't remember, but he was so nice to me, and I felt so bad. And I'll explain later why. Anyways, he comes to the waiting room and he's like, Erica, and I was like, hey, can I bring my mom in? And he was like, we're gonna get you prepped for surgery first. Once you're prepped, then your mom can come in. So I'm like, okay, prep for surgery. What does that mean? Like getting dressed in like a gown and stuff? Like, no, that's not all it meant. No. So that is what I had to do. First thing I had to do was pee in a cup. Obviously, they had to make sure I wasn't pregnant, nothing was going on. Perfect. Then he puts me into, so the room was actually divided by curtains. So it was like those kind of rooms. That's where I waited for until going into surgery. So he gives me like a gown, socks, and a hairnet, I think is what they call it. And he's like, you have to be completely naked, just your underwear on. The gown was so huge. I'm so skinny. And I was like, he's like, hey, do you have the gown like tied up? And I was like, my dude, this gown wraps 3 times around me. And he's like, oh, okay, so then just wrap it and like just leave it. And I was like, okay. So he lays me down. I'm like, oh, I'm about to be laid down already? Like, I'm laying down? Like, it's like almost like he said, like, we're about to put you down. Like, no. All he said was lay down. So I lay down on the stretched bed, the bed, and I was like, oh, man. And he put the covers on me, everything, like, and I literally felt like I was about to go in surgery, and I'm, like, looking at him, like, bro, you said I was gonna be prepped, like, you did not say this was gonna be this fast. And he was like, don't worry, it's not gonna happen yet, like, you're good. And I'm like, okay, that's fine. So he's like, we're just gonna measure your blood pressure, fine, whatever. Then he starts pulling out the IV. And I was like, what is that? He's like, we have to inject this needle in so we can give you fluids. You haven't eaten or drinking since the night before, which you're not supposed to, and I didn't. We need to give you fluids so you can stay hydrated and stuff and have all of your nutrition. And I'm like, you're gonna do what? You're going to inject a needle? And needle where? And this is where I started to feel bad because I really gave him a hard time. He was like, what do you mean a needle where? I'm gonna inject it in your hands. I was like, my hand? It's not even gonna be here, you're gonna do it on my hand? And he was like, we need to inject it in your hand because we want to do it as furthest possible away from your heart. And I was like, my heart. I hate needles. If you watched my last video, just getting blood work done for the surgery was like a hectic thing for me. I hate needles. So I started to cry. And I started to cry. And he was like, he was so nervous. Like, he was like, this girl can't go through with the surgery. Like, there's no way. So I was like, I wish my mom was here. Like a little baby. Oh my God. I did say that. I was like, I wish my mom was here. And he was like, do you want me to go get her? Like, I'll go get her. She wasn't even supposed to be in there in that moment. But I was like, go get her. And my mom tells me that he goes in like super nervous. And he's like, Mom, like, I don't think she's going to be able to do the surgery. She can't even get the IV in. Mom's like, what? Give me 5 seconds. Let me go in there. She was ready to whoop my ass. She walked in there and she was like, do you want to get up and go? Let me know. Do you want to get dressed, get up, and go? We can go. And I was like, Mom, relax. She's like, no. What we're not going to do is play like we're kids. Like, no. You're going to get the IV done, and you're going to get the surgery done, and we're going to do it. If you want to get up and go, we're going to go. And I was like, damn. So I couldn't back down then. And he was like so nervous. And she like held my hand, and he put the IV in, and it didn't even hurt. It's really all just, I swear to you, it didn't even hurt. Just like it was when it came down to getting my blood work done, it did not even hurt. It's all psychological. I'm really just like crazy in the head when it comes to needles. The reason why I was so nervous, and I forgot to include this part, was that he looked at me and he said, this is the worst part. Poor kid thought that was gonna help me. He thought by like saying like, this is the worst part, like this needle that doesn't even hurt is the worst part, you're good. Thought that was gonna help me, but it didn't. That only made me more scared of the needle because in my head I was like, all right, here comes the worst part, but it didn't even hurt. So once they had the needle in, I was good. I was straight because every fluid, everything, even the anesthesia was gonna go through that tube. They were never gonna have to inject anything else in me again. I was not gonna feel anything else again. That was literally the worst part. So be prepared for that for anyone who wants to get breast augmentation. You just have to get the IV needle injected and you're good. And I swear to God, it did not hurt. So Dr.Aydin comes out. It's like an angel sent from heaven. I'm like, thank God, like we're gonna do this. But that's when it like became real. I was like, oh my God, we're gonna do this. So he comes out and he's like, all right, stand up, let's mark you. He grabs a Sharpie and starts writing all over my itty little bitty boobs. And he starts marking where obviously he's going to probably create the incision, where he's gonna put the implant, whatever. He starts making his markings and I'm like, holy crap, this is gonna happen. And then he's like, all right. His nurse then comes and she's like, all right, and now you can say bye. And I was like, that was like the saddest thing for me because it was like, what the fuck? Like, it was like so sad because it's like, what do you mean say bye? Like, so I didn't even like engage in a hug with her because I know I would start bawling. So I was like, peace, like, see you after, like, bye, like. And the nurse took me into the surgical room. The surgical room is the most scariest thing. It's the scariest room I've ever been in. And I'm not going to sugarcoat it because I would want to know. I'm being so serious. Like, the bed was like this big. So, because you're not going to move. You don't need to be comfortable. You're going to be passed out. It's just very, very scary because, like, dude, I saw them, like, I literally, like, you see them prepping for surgery. And you see them prepping for everything. And it's very surgical. And it's not comfortable at all. I had two huge lights like on my head, like, and I was just laying down and like I felt like I was in a movie. It's a very scary feeling. I wish they would have just like put me to sleep already, but they had me wait a little bit, and then the anesthetist came in because there's a specific person that studies for this kind of thing. Like, he had to know like how much I weighed, how tall I was, how long the surgery was gonna be, so he knew how much anesthesia to put into my body. So he's talking to me and he's like, all right, I'm putting in antibiotics. I'm like, okay. And I felt it. You feel the fluids going up a little. He's like, I'm putting in one more thing. And I'm like, all right, go ahead. Just inject whatever the hell you want to inject. I don't care. He's like, all right, I'm going to inject the anesthesia. You're going to be knocked out in 2 seconds. And I was like, no. Knocked out. That's literally all I remember. I remember the last thing I can tell you, the last detail that I remember seeing, I swear, was when I actually had time to look to my right. And 3 of my pictures of my pre-op pictures of my boobs before were on the wall. So they were there. Like my frontal, my oh my god, I can't even film without putting my boobs at danger. Anyways, so my frontal, my side, and my other side, like, but with no boobs, obviously. So that's the last thing I saw. That was a pretty cool image for me, because then it's like, all right, like, it's like peace. It was like, bye. So I woke up already in the room I was in the first place, my waiting room. And I actually woke up very slowly, so you hear like a faint like beep, 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 like at the end. And I wake up and I see my mom, and I'm like, all right, perfect. Like, okay, I'm okay. I think I'm okay, because, you know, she looks good, so I think I look okay. Afterwards, all I felt, I didn't feel anything at first, because I was still, like, the anesthesia was still, I was awake, but the anesthesia was still there, you know. I still had medication in my body. Like, I still didn't really feel it. Dr. Aydin warned me that I would feel it in the upcoming hours. Like, towards the evening, I would start to feel like the pressure, and that's when I would start to take the medication. What's crazy about this whole thing, and I really hope that none of you guys do this, is plan your surgery on a day that it snows. November 15th was the day of the snow. I don't know if you guys know, but November 15th is the day that everyone took like 5 to 8 hours to get home. Okay, something that normally takes like an hour or 40 minutes, 30 minutes, it took 5 to 8 hours to get home that day. Not sure why. I don't think anyone expected the snow to be that much, or they didn't clean the streets, whatever it was. I just know I left the surgery center at 4 p.m. I got home at like 10 p.m. Like, no joke, it took me 6 hours to get home. And let me tell you, that was the worst drive of my life. Like, my parents felt so bad, but it's like no one knew. None of us knew this was gonna happen. So like every like bump, oh my god, it would kill me to the core. It was just insane. So I hope you do not book your surgery on a day that it snows. I do not recommend it. It was not okay. But yeah, that was my experience. I can tell you now that I am so happy that I did this. Like, my confidence went from like 0 to 10 in one day, literally, because immediately I already felt it. Like, I felt the difference. Like, even in that 5-hour car ride when it was like bumping, I was like laughing about it and telling my parents, like, dude, I've never felt this before. Nothing's ever moved here before. Like, I never had anything to move up and down before. So it was so funny, but like, I do not regret anything. It was the best experience of my life, and I would literally do it again in a heartbeat. I'm so happy with them. They look so good. I love them. I dress differently. Like, I look at shirts that I would never look at before, like shirts that I could not wear, because I would have to think about, like, well, I have to put a bra with that, because if I don't wear a bra, I look like a 5-year-old. So if that can't be worn with a bra, I can't wear it. And now I think of things differently. My bras definitely are all gonna be like thrown out, obviously. So for all of you that want to know my sizing, I went from a 32A to a 32D. Now, I'm a 32D, I believe, because I'm still swollen. I'm a 32D now. I definitely think that in 3 months when I get my final form, I'm gonna be like a 32C or a 34C. So yeah, if you have any other questions, feel free to DM me. I will answer them from here on out. I didn't want to answer them before because I wanted to answer them in the video, but now, if there's anything that I didn't answer in this video and you still want to know, please feel free to DM me. I'll literally answer any question you guys have.